Hi, everyone. Thank you for being here. As an introduction, everybody on this Zoom is a guide. We've been guiding for different amounts of time. We guide different kinds of things, and we guide in different ways. And that's a big part of what I want this conversation to be about. I want people to see that there are lots of ways to guide, and there are lots of ways to have these experiences with psychedelics and with different medicines, and that it can look a lot of different ways. The most important thing, of course, is that people are being safe, but safety is a big window, and a lot of guiding types can happen within that safety window. I'm going to have Leah start the intros, please, and we'll go from there.
Okay. I'm Leah Trammell. For all intents and purposes, today I guide with ketamine mostly, and it's in a clinic. It's in a psychiatric outpatient clinic that I do, and so it is in my office. I do it in two ways. In generally, when I am guiding one-on-one, it's in a private setting in my office, and it's about a 90-minute session.
Yeah, thank you. Sarah, will you introduce yourself?
Yeah, I'm Sarah Call. I've been guiding for about 15 years, mostly just friends or word of mouth, and only about, I don't know, 4 or 5 years ago where I kind of started doing it a little more professionally. And then just the last 2 years where that's kind of all I do right now. So just kind of building there. And my settings right now are typically group ceremonies. We're usually just like in a big room together, and like I've been using this space in Bluffdale, and it's just one big room. And so we kind of curate it and bring everything that we need to the space. And then also I use Airbnbs a lot too for the guide training program.
So you not only guide people, but you're teaching people how to become a guide.
Yes.
Yeah.
Yep.
And what substances do you work with? What medicine?
Oh, yeah. So psilocybin, marijuana, and Blue Lotus are mainly like in the ceremony. That's typically what I use.
Awesome. Thank you. Angie, welcome. And tell us a little bit about yourself.
Yeah, I'm Angie Lily-White. I've been guiding for a little over a year, mostly one-on-one with psilocybin. And in my home, I set up a space in my home, and or I'll go to friends. I've gone to friends before to guide. And I just set up a nice space here.
Awesome. And you said you do it with psilocybin. And the other thing you do is you're an integration coach, right? Tell me a little bit about that.
I learned a method called self-inquiry for about a year. I was in school for about a year for that, and it just helps you get out of stories you're in. So a lot of times things come up with guiding. It's a good way to clear those stories we find ourselves caught in.
Awesome. And do you work with people, do you integrate with people who you have been either didn't have a guide or didn't work with you to start with? Do you work with?
Yes.
Yeah.
Yes. Yes.
Okay.
Inquiry can be separate from the guiding, but they also work in tandem very well.
Awesome. Great. Thank you. And I'll give a quick introduction. I'm Sarah Urquhart. I also guide. I generally do one-on-one with larger doses, but I definitely have, when I do retreats or other things like that, I will do group ceremonies. I shouldn't say only, I mostly work with psilocybin by itself, but occasionally there will be something else that's sprinkled in, usually not from me. It's something somebody else comes along with, and so sometimes that is part of the journey. I think that is, and I usually work in my home. Same as Angie, I'll go to someone else's house, and I one time had somebody who preferred to be in a hotel room. So I've done that as well. So, okay. So what I like about that is we're all doing it a little bit differently. And I like that Leah's here and she's representing this clinical setting, which I think is a really important and very legal way to do this right now. But I also don't know that it's everybody's cup of tea to be in a clinical setting. So I like that, we have different kinds of options represented here, and I'm hoping that'll be part of our conversation. Okay. I want to know what your intake process looks like when you're working with, especially when you're working with somebody new, somebody you haven't, either you don't know, they came to you, they were referred to you, or they found you in some way. What does intake look like when you don't know that person? Sarah, can we start with you on this one?
Sure. My way is probably a little controversial to the outside world, but it's I very much tap into my intuition if I don't know somebody at all. And I still have a really good in-depth form that I send to people. Kind of, we need to know about pharmaceuticals, height and weight. We need to know a little bit of background history, emotional stability, things like that. And then also intention and fear is a big area that I go into during intake. So they fill out their form, and then I call them later, and we have about an hour of an intake session together. And that's kind of where we discuss dosage and what the day is going to look like, and get all their fears out of the way, like I mentioned, just stuff like that, so that they feel comfortable with me. Intake is also just like this over like a Zoom meeting, so that they can see me, that I can see them, kind of just, get to know each other a little bit and feel comfortable.
Perfect. That didn't sound controversial at all.
Good. A lot of people think intuition is so like woo-woo and weird.
Oh, I see. That's the
not-
controversial part. I see that now. That's probably happens to all of us, whether we claim it or not. Angie, how does your intake, does that look different than what Sarah said, or tell me about yours?
Did you say me?
Yes, Angie.
Very similar. Very similar. So in addition, I think just to make sure that they feel comfortable, that they know that I am honored to be doing this with them, that they're not bugging me by taking up space.
Yeah.
Making sure that they know I'm sitting in non-judgment. And I think that either Marco Polo or going out for coffee, I mean, besides everything Sarah said, that's all extremely important, but also just making sure they know that I'm sitting in non-judgment with them.
Love that. Thank you. Good addition. Leah, I know yours is very, very different or a little more intense. So what does that look like?
Yeah,
And do you do
that
it? Does
is.
someone else at the clinic do it?
Yeah, so for me, it's a very thorough medical evaluation, in the sense, getting records and making sure someone, cleared in that they can medically tolerate, and we're not putting someone's physical risk or physical health at risk with ketamine. So that's discussed extensively. And then I do a good psychiatric evaluation as well, making sure that there isn't contraindications for a psychedelic. And then, so once that's kind of already discussed, if there is any sort of medical question, or if there's absolute contraindications, then it's like, hey, this is an absolute, and psychedelic isn't going to be a good positive thing for you.
Yeah.
Not often is there just this really, really hard no. But there is, there are some that it's like, well, this is things we need to possibly work on before we can move forward, right? Whether it's medically or psychiatric. So whether it's getting clearance from other medical provider, their specialists and things like that. But yeah, so along with, if they're cleared with those two things, often is talking to their therapist, if they have a therapist, and things like that, making sure that they have that. And then getting a fill. I do always have to have a one-on-one in person. So we do, so along with the evaluations for those things, I'm getting a one-on-one fill for that person, and it's an hour. After we have that, and it's really kind of more of like, do I feel like there's still some things that need to be kind of thought through and assessed, and if I have some more things I need to fill out, like I need to think through and get from them. The other part is making sure that they have enough outside support. So at home, do they have a social structure? Do they have support there? Because as we all know, as they're going through this, there's a lot that can come up. And so how is their home? What is their home life going? Are they, every time they go into a psychedelic, and then do they go home to a very toxic situation that is going to, cause a lot of issue there? And if that is, what can we do? Or maybe that sometimes that will be like, hey, we need to make sure that that is better before I'm bringing you in, putting you in a very vulnerable situation, vulnerable state, and then I'm sending you off to the wolves again, so there's a lot that can go into that. So that's part of it. And then also setting up an integration plan. So whether they're doing that with me, it's usually you're doing it with me and you're doing it with your therapist as well. So they usually have a therapist along with me doing that. So coming up with the plan that way too. So.
Awesome. Yeah, I want to talk more about integration in a minute, but can you tell me can you give an example or two of what some of those hard no's have been for you in the past?
Yeah. So medically, if someone has a history of like heart attack, if someone has, so cardiac things, that they are at a high risk for that, psychedelics are definitely can put them at a very high risk for that. So stroke or heart attack, aneurysms. Yeah. That is definitely like, if it's been like, oh, I had one a really long time ago, my cardiologist is fine. It's like, all right, well, I need a letter from a cardiologist clearing you for that, right? Seizure is another one.
Okay.
But again, if someone is actively, if they're epileptic and things like that, that's usually like probably not. Pregnancy, hard no, that's
interesting. Yeah.
Not happen with that, because there's just not great data on what that can do.
Yeah.
So
great, good, very, very good examples. Thank you for sharing that. Yeah, let's talk for a minute about integration. When that's a big part of my prep is understanding what someone's integration plan is going to be. Not everybody has a therapist. Not everybody can afford that, or, has it in their life at the moment. But I don't necessarily think that's a contraindicator. It's just then we need to be a little more detailed about what that integration plan looks like. So I would love to know, does anyone feel like they're pretty good with helping someone develop an integration plan? I'd love to have someone kind of talk about what that looks like. I can talk to it, but I don't want to talk over if Angie or Sarah, Leah, any of you feel like you're really good at that part of it.
I mean, I do, because a lot of my population, they don't have therapists. They can't afford. Yeah, I mean, a lot can't. So I definitely have a lot of it. One, it's check-ins, it's like, okay, what are we doing? So when they're coming back for treatments, we're checking in. I've put together a lot of, I don't know if I want to say workbooks, but more, just kind of templates and things to kind of help them work through things that come up. So to help kind of prompt and help them kind of keep on track. So that's kind of a lot of it. A lot of somatic work in the sense. So other exercises there. But a lot of it is just really self-guiding. So, me trying to help them hold themselves accountable and keep moving and work and staying motivated. Yeah. It's really trying to give them the tools and some guidance, and being like, okay, if we're doing this without, someone helping you through that, and that's you, then here's some tools that you have. So yeah, a lot of like some workbooks, instructions, templates and things for them to just kind of use and use daily as they are moving forward.
Awesome. Sarah, what kind of how long do you give integration support after you've guided someone?
So now I only offer like one session that comes with the experience, right? But then I have an integration package they can purchase, and it's different lengths of time. Okay. I've just found that a lot of people are not kind of willing to do that, right? And I was just like pulling a dead horse up a hill a lot, and understand in my life how many times where I wasn't ready to do like extra work in something, And to me, that does not mean that experience wasn't completely beneficial to them. So integration for me, but same as Leah, a lot of, like links for somatic work that they can check out. I try to take the pressure off of me, and I have a really strong resource list for people. And then I just check in, especially if they're kind of, emotionally unstable a little bit. I check in more often and see how they're doing, but definitely, it's kind of self-motivated, which can be hard for people. And I also, the resources, I have a lot of therapists in my back pocket that I can refer out. And I love to work with therapists. So that is kind of one of the things that I really do appreciate, when someone does have a therapist, that we can talk before and after a little bit to help.
Agreed.
In that integration.
Yeah, that's awesome. Angie, do you have a set amount of time that you give people for integration after?
Not really. Not really. I have found that most of mine that I have guided, I have found just want to talk about their experiences. So really for me, I'm always happy to listen to people's experiences on psychedelics. And every once in a while throw in a question or two that I remember from their trip that maybe they had forgotten, but just being a safe place to listen has been a big one. And then the checking in often.
Okay.
Yeah.
Yeah, I guess I'm asking about timeline because I do have that. I do lots of checking in for about 3 weeks. And at that 3-week mark, I kind of am like, it's, go and be free. But some people want to continue, right? You guys I think you all know Justin. Justin and I just kept talking. I let him go at 3 weeks and he didn't go anywhere. And we absolutely just became friends over the last couple of years because we've just continued those conversations. But I do have a number of people that I guide who at that 3-week mark, they're done. They've moved on to their integration process. They don't need me anymore. And, that's fine. They get to lead that they get to determine how much or how little they want to have interaction with me. But I do take it to at least that 3-week mark, checking in repeatedly just to make sure they're, kind of getting their feet back under them. So,
yeah. And I think I think it definitely is, kind of that cute moment as they're going through and there's a lot that comes up and you're trying to guide them and help. And really it's just kind of trying to give them all the resources and tools that they need. Right. And at that point, then it's like, okay, well, just let me know.
Right. If I see them, they're journaling. They do have appointments with a therapist. Yeah. And I'll flat out say to them, either beforehand or, if their therapist doesn't know this has happened yet, I'll say your first appointment back is to help, talk to your therapist about creating this integration plan. So, really I like the idea that people are formalizing that a little bit for themselves. Doesn't mean they'll stick with it forever. At some point it does start to fade off, but I will say people who really stick with it get far more out of their experiences if they build that, if they're really serious about their integration.
Well, I think that's what creates the sustainability of the changes, right?
Right.
It's really integrating that into their lives, And ketamine is a little different. Generally, it's not a time to time thing. I'm doing it I'm usually with that person, once or twice a week for 3 months, that we're doing really deep dives and going in there and working through a lot, so it's repeatedly doing things. So it is a little bit different in that sense. We're doing a lot for an extended period of time or somewhat extended period of time. And so during that time, it is very much like, hey, what are we doing every day, every week? Like, especially 2 days, that the day of treatment and the 2 days after, there's a lot that we focus on there. And then as it starts to extend out further, how are we keeping the changes moving? How are we keeping the insight? How are we integrating that? But then after they're done, some people then are done and I only see them after the 3 months.
Yeah.
Once every 2 months or, things like that. But then others are coming to me still once a week. And, but just kind of all depending. It just kind of depends on what that person is still needing. Through.
Yeah, I know this isn't true of your clinic or certainly of the services you provide, but I'm surprised how many ketamine clinics don't offer any integration support
At all, unfortunately.
And that just feels pretty dangerous to me.
It is, unfortunately, and surprisingly to me, when I first got into this, a lot of people had no idea what they were getting themselves into. Yeah. They went into an intake and then they were like, oh, I just went into a room and they gave me ketamine and we're like, hey, see you later. And I was like, wait, what?
Yeah.
and so people really just had no idea what that was. And it could be very unstabilizing, right? Because there's a lot that comes up. And so I think it was, and honestly, when I was working family medicine and I started hearing these stories and I was already into exploring psychedelics for healing and things, that's where my passion came, was hearing this really irresponsible practice. And I was like, what is happening? So it really, I think there is utility in ketamine alone. Like we know that there's some antidepressant effects just in the medicine alone, but it definitely is not done properly in my mind if there is not knowing that integrated
support
processing is, like that is such a huge part, right? The medicine is only a third.
Well, and it's what
of the process.
It's so disorienting that if there isn't someone there to help you frame it, whether it's your sister, your mother, your doctor, your therapist, your friend, I mean, it can be a million people. It doesn't have to be a therapist. It doesn't have to be a doctor, but people need to understand what just happened. We don't have the language for it. We don't, and after you're in the space quite a bit of time and having multiple experiences, it's not nearly as disorienting as it is to begin with. Yeah. So you don't need that full support that you need when you're first starting out.
And prepping people, I spend all this time prepping them and talking to them about it, and they have an experience and they're just like, what the hell? You're just like,
I hear it more often than not. This was not what I was expecting.
Not what I expected. And so it's like for them to not have any of the prep and then not to know what to do with what the hell. Yes. It's like they're walking out of there going, what? And just, it can be really, really stabilizing. It's really surprising.
Yeah. So whether it's happening in a medical facility, clinic, or it's happening with a guide, or if someone's doing it on their own, that's what we're talking about. If you don't have any kind of support, it can start to feel dangerous because you're just not even sure how to frame the experience.
Right. And I think people, even the smallest knowledge of like, oh, I just had this huge, what we think, or like, you'll have this huge mind altering thing. And, one of the biggest things that you tell people, like, it could have been just this amazing, beautiful thing, but you're like, don't make big life decisions for the next 3 days. What do you mean? I have this amazing thought and it feels so good. I know. Act on it.
The time.
Don't do that, but they don't understand that. So if they didn't know that, right? Like even just that really basic knowledge is like, I mean, that can really just blow up somebody's life.
Yeah. You're 100% correct.
Come on,
Well, so, they're finding now, just to talk about integration a little, specifically with psilocybin, but they're finding now that the neural pathways that are, like the new neural pathways that are being made in those experiences, that if you're not doing the integration work, you're kind of doubling down on staying the same. And which is, new studies coming out, which is really interesting to see that people can be like, oh, I've done psychedelics for 30 years. Like, I'm so cool. And you're like, well, you're pretty far behind, bud. It's time to do some integration work because it's just.
Well, you're blasting it open and then you're like, you're not doing anything with it. It's just like back down to a weird, back down.
Yeah. When I prep my people, I say 5% is prep, 5% is the journey, and 90% is integration, right? It's because at first I was like, oh, 25%. And then I'm like, no, none of it matters if you don't make those real changes. You know, my other little thing I say is it's only life changing if you're willing to change your life.
Right.
But if you keep
Yeah.
everything the same, it's not a life changing experience. And in
No.
fact, it can be detrimental because
Yeah.
people have these big ideas, nothing changes, and they can get very depressed.
Mhm.
They don't know what just happened. And so, yeah, it's the life changing element comes afterwards when you're digging in and going, oh, I had this insight about a relationship with my child, or a relationship with my spouse, or, parent, whoever, and I'm going to make these changes. I've seen these insights. I feel differently now, and here's something I can do. And without that, yeah, you're just staying the same. That's interesting. You're saying it doubles down on staying the same. Fascinating.
I thought that was one of the most fascinating things that I did in a long time, of like, oh, this integration is way more important than we even thought, because it's just that's a physical thing in your brain, that's big.
Right. You just had a crazy night.
Yeah.
Which, that's not a bad thing. If
Not
you want to have a really creative and exploratory night, that's a perfectly fine way, a recreational experience. It's a fine way to take some of these substances. But if you're really looking for change, then it looks a little bit different generally.
Yeah.
Mhm.
Definitely.
Okay, I want to know how Sarah, you mentioned this, you like working with therapists. Talk a little bit more, any of you, if you can talk more about how you see that working, how it has worked for you. I know on my end, meaning if I'm going to give information to the therapist, fine. The therapist is giving information to me. We need to sign some waivers and things because that therapist has HIPAA laws they have to abide by. I don't have HIPAA laws. There are moral things I should and shouldn't be doing, but that's, you don't need to sign a waiver for that necessarily. So, any thoughts?
I feel like some do, some don't. Some, I've also run into therapists that were kind of almost against it. So it felt like it was really hard to even talk to them about things, and maybe since I didn't have letters next to my name, that my information wasn't as valuable, which is fine, but it doesn't help their client, right? It doesn't help the person.
Right.
But also I've worked with some great therapists that are psychedelic friendly, that understand that this is great work, and that in tandem we can really help somebody move the needle forward. And usually it's only a little bit of the intake session and then an integration session together. So it's not like I'm there for weeks on end with them. It's just this is kind of what happened. This is what we talked about beforehand. This is what happened. And then, the participant tells us what epiphanies they've had, what's come into their life before. That's how I always do integration. It's you tell me what's happening for you first before I ever tell you any information. People's minds are raw and open and vulnerable. And so the words that we say can really impact them. So, but working with therapists, I think, is really wonderful, especially, when people come into the medicine and they are emotionally unstable, it's really hard to help them. But you're to want, to be yeah, let's do that, or let's work on some things first. And sometimes people are I'm doing this with or without you. Let me, you're okay, well, I can help you and keep you safe, but I really suggest that we need to kind of work on some of these things. And that's where a therapist can really help that long-term emotional behavior change, where if somebody, like you said, is so depressed and just so in their way, one mushroom ceremony isn't going to change it. It's not that magic pill that you're looking for. They definitely need long-term integration.
Angie, any thoughts on therapists?
I know my lane, and so I like having therapists to refer people to. I'm not going to try to become a therapist. I know I'm not one. Haven't had that education. I know what I can offer, and I don't try to offer more than I know. I had the opportunity to guide a therapist, and I loved that because it wasn't what she was expecting. It opened up her world, and she has clients who are wanting to get into this space. And I love that she was open to do that for herself, but also for her, her practice and
Yeah,
for her patients.
she can impact others because
Mm-hmm.
confidently say what the experience is, and probably she can help determine who is going to be a good fit for this and who isn't of her.
Right. Mm-hmm.
I don't necessarily think a therapist has to take psychedelics, but I
Mm-mm.
do want them to be psychedelic friendly, meaning they're going to believe the insights that are coming to them from that come out of these experiences. They're going to believe their client, and then they're going to help integrate those into their life. I had that experience with my therapist the first time, and he had no interest in psychedelics, but he absolutely was he really helped me integrate. It was a really beautiful year of therapy after that, one of my experiences. Leah, do you have any thoughts on therapists and, that kind of support?
Yeah, I mean, I think one, it is kind of, if someone has a therapist, that's the person that's going to long-term help them kind of continue to make those big, changes, long-term changes. Yeah, and I'm not a therapist. But it is more, it's whatever that person is needing. I think if their therapist is not psychedelic friendly, it's wanting to know that, because then needing to understand, again, what's their support structure, then who do they have to process and integrate with, so trying to get the idea and help them find the resources then, if it's not their therapist, right? But yeah, I definitely love to work with therapists, and if it's helpful, I mean, there is always the HIPAA. So if the person I'm working with, if my patient wants, if I can talk to their therapist, then like, yes, please, we sign the papers, and it's like, yes, let's talk. And I love to have that conversation with their therapist if I can. If it's not possible, that's okay too. You just go with what you have and do what you can. But having an idea of who they're able to have in their corner per se, right? But yeah, I love doing that. I have had the opportunity to, not in my clinic, but to work with we co-guided, me and a therapist, and that was actually a really lovely, beautiful experience. And so I think it's really great, right? So
Lovely.
being able to combine the two and knowing that. But I do think a therapist, ideally in an ideal world, is someone having a therapist that is there just helping them continue to move and grow and build off of what they're learning in these beautiful spaces.
Well, and I love that so many therapists are at least understanding the benefits of psychedelics, whether they choose to participate personally or not. They are understanding that. And I loved that one of the therapists that I met with for the interview earlier was, she flat out said, "Oh, when my clients or when I know they're doing psychedelics, it just means we're on the super highway toward healing, right? It just means it's working faster. We're gonna be able to tackle these things a lot quicker, a lot easier." And yeah, I hadn't thought of it that way, but I'm sure that must be true, right? For a therapist to go, "Oh, happy day. We've been stuck on a few things. Now let's get moving." Because that was, again, true for my experience.
Yeah.
Okay. I'd love to ask about, touch and consent. It's, again, when therapists are talking about guiding, I kind of see those two things as different. I know can't always be that way. It shouldn't always be that way. But a lot of times I can do things as a guide, like touch, that would be completely inappropriate for a therapist to do, even in a guiding sense or a guiding ceremony, guided ceremony. So how do you guys deal with touch? How do you talk about it? How do you talk about consent? And we'll go around, but then Leah, I'm sure whatever we say might be different for you. So I am curious about what that looks like in a clinical setting.
Yeah, okay, so touch is important for me. And because it's so important for me in my journeys, and pretty much, I'd probably say like at least 95% of who I guide wants to be touched at some point throughout the journey. So for me, it's when we're doing kind of like right before the opening ceremony and I go over the house rules, we go over touch, and I stand up and I say touch means from the shoulder down, it means from the knee down, and it means a hug. And if you're okay with that, and I make everyone look me in the eye and say yes, like, yes, I'm okay, or no, don't touch me.
Right.
And then I also say, if you say no, just remember that I ethically don't feel like I could touch you in the ceremony. And sometimes you feel like you might need a hug or something gets really hard, and a hand can help you ground in ways that you just can't explain. And so it just is very upfront and open. And then I just kind of take a little poll of who's okay and who's not. And then we just go from there.
What's your percentage of people who are okay with touch and who are not?
Almost always, yes.
Almost always.
And participants are not allowed to touch each other, because I do a lot of groups. So that's another thing I say is participants are not allowed to touch each other.
Yeah.
But and there's just a million things that, the cuddle puddles that happen and stuff, which is fine for some people, but for me it can get a little touchy, and then things can happen outside. When you come back into your body, you can feel really maybe violated or taken advantage of in ways you just wouldn't expect, because when you're on the medicine, your heart is wide open, and so that those things can feel good. So it is super important for me to talk about touch.
So if somebody says no, and then they're in the ceremony and really they're saying, no, I know I said no, but please, I need a hug. Where are you on that? What do you do?
Well, you know me. So again, I tap in, like, am I safe, right? My safety comes first.
You use your intuition.
Right. So if I tap in, if I'm safe, then usually I'm fine to hug somebody. I'm really, like, I think hand holding is one of the most best things for me, is to hold someone's hand. And then we kind of talk about it after, like, just like, how are you feeling about that? Is that what you needed in the moment? And I haven't run into any issues with anything, but it is hard. You're kind of like, shoot, they said no. But I've had some in that kind of almost jumped on me. Like, I know I said no, but please touch me. Please touch me. I can't, this is too much. I don't know what to do. And at that point you're like, okay, we just got to kind of follow what the medicine's asking us to do. And as long as they're not inappropriate or anything, I'm usually okay to do that. But I try to make it as big of a deal as possible so that we don't run into that issue,
Yeah. Leah, tell me about what happens in the clinic.
It's pretty similar, right? So before every time, it is the conversation you have. Are you okay with safe touch? And then again, explaining what that is. Hand on the shoulder, hand on the elbow, holding your hand on the knee or on the foot. And then every time it's asking them that. You can change your mind at any time in that sense, right? It not like if they say no, I have not had someone say no yet. But if they do say no, and then it's or if they say yes, and then in the space, and if I were to, touch their hand and they were say, I don't want you to touch me, of course I will not touch them for the rest of the time, right?
Of course.
But it is the hug is one that's a little bit more difficult in a clinical setting, right? Even though to me, if I were to give my opinion, it's like a hug is a hug, not a big deal, but it is more generally a little bit of a different but it's the people are laying down and I'm not, they're in a chair. And so if they're needing a little bit more of more than just like a handhold, it's more than generally I have my hand on 2 points of contact, so holding their hand and holding their shoulder and just kind of, leaning in a little bit more. But not usually a hug can be a little bit more difficult. So I, while they're in the medicine, usually hug is not something we do.
Yeah.
So that's usually how we deal with that, but it is generally acceptable in training, even in the clinical setting, to do comforting, grounding touch for that. It's just as long as it's talked about and consented to before each treatment.
Yeah, I love that. I'm going to talk about something none of us have anything to do with, but I know it's happening in the larger community because we're getting reports of a clinical or religious setting where somebody is putting people under the medicine and then hitting on them, ultimately having sex with them. I want to talk about that for a second because it ties so closely to consent, and it how do we, as guides and people who are active in this psychedelic community, the psychedelic space, thoughts on how we deal with that, thoughts on how we talk about it, thoughts on what this person's doing. I mean, who wants to jump into this one?
I will.
Okay, Sarah.
I think that that's exactly why touch is such an important conversation to me, because people, some of these people really are like convincing mostly women when they're under the medicine that it will heal them, right? Like their sexual trauma, and that makes it even more awful for when they come out of this experience. So I think that it's completely wrong, right? It's completely unethical. Even if in that moment they say yes, we just don't, right? Like
we can't consent when we're under the, you can't consent. Consent is off the table.
No. And so it's so wrong. It really is hurting people even worse. And it's not helping our niche of plant medicine at all, right? To which we're all trying to help move this along and feel like it's been a calling for a lot of us to kind of help this route. And also it just makes you feel awful. Like, this is what I do. And then there's other people that do what I do and they're not doing it and with a spiritual positive intent to help others. And it's just, to me, it's completely wrong. And I think that that's why we need to stand up even more. And we need to help people even more so we can say this can be very safe, and I love that we teach a lot in our community that your intuition is the most important thing you have. Like, do you feel safe when you walk into the room? Like, check your gut, like some of these people go, like, they find us when they're in despair, right? Like, people find us when they've tried everything
else. They've tried everything else.
Yeah. And this is like, they're like, crap, I'm going to try something that is really scary that I've heard not to do my entire life. And so then, even more is kind of stacked against. So I guess to me, touch, like talking about everything that feels weird is so important. Like just bring it up, get everything, all the weirdness, all the fear, everything that's coming up for somebody, get it out beforehand. So you kind of know what you're dealing with. And then making sure that if somebody has, right, like people have tried to touch me inappropriately. People have tried to kiss me. And people, things like that, where I just say it exactly like that's an appropriate touch. Like, I just call it out like that. Nothing, in a nice tone, loving, compassionate way. But that's it. That's inappropriate. And I move their hand, and I just kind of walk them through, like, your heart is very open right now, and you're receiving a lot of healing. So chances are you're not in love with me, right? Like you say you love me, but I'm pretty sure you probably don't love me that way. And we'll find out in a few days,
No big decisions.
Yeah. Big decisions.
Leah, do you have any opinions on this?
I mean, I think we need to call a wolf a wolf, right? I mean, these are predators, and they just definitely they should not be in this space. Yeah. They are people that are coming in the most vulnerable state, not only even not in medicine, but then they're coming to you and you're putting them in the most vulnerable space ever. And they just should not be here. And there should be no room for it. There should be no tolerance for it. And I just think whatever we need to do to minimize the possibility for people like that.
Yeah, agreed. Angie, thoughts?
Just zero tolerance, and just the importance of setting expectations before a trip. So with the touch, and having conversations about that it's happening and that you're safe with me, and
I love
talk about it.
I can't tell other adults what to do. Well, I can, but they don't have to listen to me. But as some guidelines, I've kind of said, if you're brand new to psychedelics, then don't even pretend to think about a sexual experience while under the influence until you've had at least 10 experiences. And I just made up that number, but I'm like, by the time you get to 10, you kind of understand yourself a lot better in these spaces. So as a guideline, that's one. Two, I can't imagine anyone having a sexual experience within psychedelics if they didn't have a sexual relationship before the journey, right? If my husband and I decide to do something, well, we have 35 years of sexual experiences together, right? So it would be less challenging for anyone to hear that story. But if you did not have a sexual relationship and you're headed into the medicine, the idea of we're going to open up that experience for each other feels crazy to me.
Yeah.
Why would, if you're going to have a healthy sexual relationship with each other, it's likely going to start in a sober space long before it should be starting in a psychedelic space. So again, everyone gets to do it how they want. I know there are a lot of people who use psychedelics and can find ways to have sexual healing. Great. I'm glad they can do that. But for anyone who's just getting started, here are some guidelines to just kind of keep yourself in check, keep others in check, so that you're truly consenting with a whole heart and not because you think that's part of the community or part of the life, the lifestyle that people are living who are doing psychedelics. It's just not true.
Yeah.
For most of us. So
yeah, and I think for us this guy, it's like, I mean, we don't know what's going on in someone's head. We don't know that, and we can't know that. But it is trying as much as possible to set up the structure and the space to where it's clear on this is what we're doing today. Right? Mm-hmm. This is the focus. This is what we're doing today. This is the touch. This is the things. Things happen to where some people, again, we don't know what's going on, and they might think, this awakened, and I'm feeling all these things.
Sure.
And again, it is that firm but non-shaming, like re-guide. I'm just going to redirect that right away, right? Yeah. But that is what our responsibility is, right? Our responsibility is to maintain that container and to, as much as possible, make it very clear on what we're doing today and what the space is for and what it is going to allow our goal to happen. And not that those, not that the feelings of sexuality and sensuality and all those things, those are powerful and can be lovely and amazing. But again, like, not here today. And that's what we get to do, and that is our responsibility to do that.
Sorry, I thought you were
I'm just that's what we got to do.
You're exactly right. And I had someone who was in this guided experience, and they were just, everything was very sexual, he in his mind was having sex with the clouds and the sun and the mountains and and then people, and it just everything. And as he was coming out of it and we were breaking it down, I just kept looking at him thinking, is it sex, or are you using sex as the metaphor for wanting to connect, with the nature and the sun and these people, and I could see his mind go, oh, I'm not a creep. He was a little concerned, and I was like, is that, because a lot of times that is the most powerful way to connect with somebody, right? So his mind was just using this metaphor, and it freaked him out a little. And so again, as a guide, I could go, you're not really a creep, but like, I knew this person, right? I knew, and of course I don't know but I knew this person, and I'm like, could it be this other thing? And he just melted. He kind of softened and went, that's exactly what that is. And then he built that into his integration about the importance of connection and seeking out these relationships. And it really was beautiful to watch. But so we don't need to be scared of sexual imagery, sexual things that come up. We just need to understand, as guides or as people in the space, a lot of this stuff can be metaphors, right? It's something in our mind is trying to communicate with us, and it doesn't always have the language. And so it's coming up with images and ideas that can be useful, can be super helpful, but we put, these filters on that mean, oh, now I have to have sex, and that's just not always true.
That's a really good plug for having a guide
Right?
and integrating.
And
Because
integrate.
if he had that experience alone, he would have been left with that,
Really disoriented.
What is wrong with me?
Right?
Yeah.
Right. I'm a
He's
piece
like
of
a
shit.
freak, right?
So yeah. So okay. So speaking of, have any of you experienced a bad trip with a client? And what does that look like?
Bad in what sense?
You get to decide.
Oh,
I kind of reframe that word, right? Bad trip
Okay.
is not really my word, but it's a challenging for me, it's challenging. And they're thrashers. They're the most docile people I've ever met before the medicine, right? Like they're very calm, reserved, working through it. It's usually they also have in common deep big T trauma is another thing, but they once they finally surrender to the medicine, it's like they start thrashing. They're rolling around the room, they're hitting things. And I mean, there's been times where you're just walking around like grabbing limbs so they're not hitting something else or hurting themselves. You're just kind of following this process. They can be screaming, and then a lot of times they don't even remember it. Like it is just like this trauma that has stored in their body in all these different places, and that's how it's getting it out. They're just they can lose motor function as well and like urinate. So it's not that it's bad, and usually those are the people that move the needle so freaking far in their own life, right? Like that is they don't know, and we don't know as humans how to get this trauma out of our bodies. Somatic work is probably the best, but it also still takes a lot longer than what the medicine can do for us. So yeah, those are kind of the ones I would say that are the hardest for me, are, people that are screaming and hitting and punching. And it took a while for me to realize like, oh, I just got to keep them safe. No talking, no trying to calm them down. Cause you get to this point, you're like, you can't calm them down. They're not responding that way. So you just kind of have to ride it out with them. And those are the ones where you see what you're made of, to me. The tough ones.
I agree. Angie, have you had an experience like that?
No, not like that. I've had a lot of anxiety. I mean, not me personally, but had guided people who are having a lot of anxiety. And I run anxious, so I understand what that feels like in medicine. But not like what Sarah described.
So would you describe these high anxiety trips as bad trips or just
No.
Okay.
No.
All right.
No, because we have gone for walks. We've, as you say, changed the channel if they want to. Some like to sit in that, and I understand that as well. I've also had a couple who have been very, very emotional, but I think sometimes those emotions need to come out, and they don't in any other space.
Yeah, agreed. Leah, how about you?
yeah. Mine are interesting. I mean, I definitely have like a very different, I mean, maybe not different, but my demographic is, my psychiatric clinic. But what's interesting is because I'm in a clinic, and if I don't have like soundproof rooms, right? So not only am I in the ketamine room with people, so I do a day where I'm in the ketamine room. So that's always interesting when someone's having a hard time. So they can be very disruptive to others, right? And that's usually that's the hardest part for me. Like I can have someone get like, they don't remember, but they get up and they're throwing things and they're punching and they're, throwing all the things. And it's like, I want to just make sure they're not disrupting others. And that's where the challenge is for me. Or if it's a private in my office and they're crying, but they're crying really loud. And to me, I'm like, I would rather just like let them, like I could be there, and the crying doesn't stress me out. Them yelling and screaming and being mad and angry, that doesn't stress me out. It's set that I'm like, I got to make sure you're not disrupting everybody else. So I have to like try and like contain it a little bit. And that's hard for me actually. Like, because I don't want to have to worry about that, you know, like I want them to be able to cry as loud as they want to cry. I want them to be able to yell and yell fuck as loud as they want to yell fuck, you know, like, so that has been a hard thing for me there because it's, I don't want to be like, I just need you to cry a little softer, you know, I just need you to yell a little softer. Like that's hard. But when they do get a little physical, and if it's a male, that's a little hard, you know, like,
Sure.
hey, how do I stay safe? You know, so I got to kind of normally bring somebody else in. And that can get a little bit because it's usually just trying to keep them safe and myself and others safe. But then sometimes it's like, okay, well, yeah, let's just make them safe. But most of my concern around it is that we're not traumatizing other people that are in medicine around them or, you know, in other appointments. So,
Okay. I had someone, I know of a guide, and she does exclusively multi substance events. She does group events. It's only in the evenings. She always does evening events. And you go in knowing and you're consenting to, which of course you don't have to participate, but the idea is we are going to have these platonic touching and cuddling that can happen in this space. That's pretty much, I don't do any of those things, right? I'm daytime. I'm one-on-one, not a group. I'm one substance, not multiples. I'm, you know, there's little touch if, you know, and it's all consented in advance. But she offers these incredible experiences, right? It's not necessarily something I would want to do, but there are a lot of people who want this, and it's beautiful to watch. Do you have, any of you, you know, kind of describe how we kind of talked about at the start, but what does if you have an ideal setting, what is your favorite way to guide? Is it friends? Is it family? Is it strangers? Is it one-on-one? Is it group? You know, kind of just give in 2 or 3 sentences what your ideal experience looks like. Angie, can I ask you to go first?
Yeah. Gosh, I just feel like this is such sacred space that I am honored to guide anyone. So I can't really think of ideally, it's just someone who is ready to jump into this magical world.
Sarah, how about you? What's your ideal?
My ideal is group. I love group so much. I'm really guide heavy, which is wonderful. I love the collaboration. I think that is one of my favorite things that I finally have allowed myself to do, and it's just changed my world. You know, it's been awesome. I love, love, love curating the space. So sometimes going to someone's home is hard because you're like, I don't know if a picture you have up is going to trigger you. I don't know if, you know, like you just kind of don't know. I do day ceremonies as well, but I make the space dark, and we use candlelight in the bathroom. We use candlelight in the ceremony space. Still just because, you know, the harsh lighting can kind of, unless we're like in it, it can really distract us and become part of the experience where we're constantly being taken out.
Okay.
So I usually make it dark. I love to make playlists. I think that's a really fun tool to use. So yeah, just really going all in on making sure the container is held. And I also make sure there's different spaces inside of that container. Sometimes people need to talk, and that would be disruptive. And sometimes people need to scream or need to go and teach Mother Earth, or, you know, different things. And so I always make sure there's a couple different spaces available, and I love group. Yeah.
Love it. I love that you love group. And yeah, anytime I have somebody who is saying that one-on-one isn't exactly the right fit, I'm pushing them your way because I know you're such a good ceremony leader for groups. So that's lovely. Leah, I know it's different in a clinic. So do you have an ideal there, or it's just what is given to you?
Yeah, no, I mean, in my clinic, I've made my office very much my own sanctuary. Like I've created it to where I have my own lighting, my own scent, my own, very much so I can create that. So it's what I want to have happen. Yeah, so when someone comes into the medicine, it's what I can hopefully try and create. Um, I I will do, I mean, one-on-one obviously is what I do most. But I have done, small groups, one, two, three, or so I don't do big groups, generally speaking. But it more, I'll go to people's homes. I don't mind doing that. I feel like I can kind of create where I need to, in that space and kind of, go there. So we're trying to soften it as much as possible. Yeah. But yeah, there is, I mean, you're walking into a doctor's office, so that's
And for some people,
but a lot of people like that.
I was going to say, it probably provides some security, some feels safer to them than some of these other experiences. So I get that.
Yeah, it does. And I appreciate that for sure. Like it doesn't, but they also, once I've created a relationship with them, they go there and then they come into my office and
to your office.
We do. But yeah, I don't necessarily have a preference on, I mean, whoever is interested and, whatever I can provide. I love this space. It is something I am honored to be in, and it is a sacred space for me. So
yeah, I agree. It's an interesting point, though. I know we've said it a time or two, but I'm going to say it a different way. There are so many ways to do this. And if the clinical setting feels safer, feels right, you should absolutely pursue that, right? If something else, if a group feels right, pursue that. My husband always says he wants the bells, the whistles, all the drums, he wants all of it. And I don't want any of that. That's all a distraction to me. So knowing that, learning that about yourself, and maybe to start with, you don't even know why. When I first started, I was like, the idea of a group ceremony felt repulsive to me, and I could not figure out why. And it took me a couple of years. My husband finally convinced me to do a group ceremony, and it was tons of sensory overload. They were burning the sage, they were doing the sound bowls, somebody was, I had this harp and he was moving from person to person, and I was like, stop. It was just everything just kept pulling me out of the ceremony and out of the medicine. And I was like, oh, I didn't know why I was saying no, but I knew instinctively that wasn't going to work for me. The longer I'm in the space, now I'm like, oh, now I know what to do with other people. I need to, so I've been in the space years, and I'm finally getting comfortable with an occasional group ceremony, right? So I'm saying all this to say, whatever you think you want, pursue that. There's probably a reason. There's probably something in your mind that's telling you this is the direction. It might not be that way forever, but to get your feet wet, you want to do all the things that make you feel as safe as possible, so you can melt into the space.
Yeah.
Talk about the importance of creating a container, what a tight container should feel like, look like, and from your perspective, and why it's so important.
Sure. For me, that's kind of part of the house rules we go over in the beginning. So I get to the space early. I'm an altar person. I set up an altar. I cleanse the space. And for me, that's important because I do call on, spiritual health and things to be in that and to protect us and keep everyone safe. And so when people come, a big, huge thing for me is no phones and no smartwatches. Is to take that out. Like that is a big part of this journey for a group especially. But I think most of us know like electronics are kind of a big no-no. People, that's such a big part of the container, because say you get a text that says, something's wrong at your house or whatever, you can't do anything in that situation. And all it does is embark fear. I also make people agree to, before we even start the medicine, that they won't leave the space. I usually will take keys and phones, or make sure they're just like separate from people, they're not going to go. I have had people try to leave before, sometimes you can get paranoid in the medicine, and I've had people think, oh my gosh, you've had me here for 2 weeks. What are you doing? Like, and you're just like, you still can't leave, and promise you it's only been a few hours, but you still can't leave. So that's really big. And then I also really tried to discourage people bringing their own headphones, making sure that, it is a group experience. And so we are all kind of on the same medicine. We're all on we're listening to the same sounds. If that gets to be intense for somebody, then I do always have extra guides so if somebody needs to go outside, someone goes with them. And all the others stay with the group. If someone goes to the bathroom, someone kind of goes and helps them, waits by the door for when they're ready to come back. So yeah, my container is mostly, of course, safety is our number one. And then we tap into the energy that the mushrooms are bringing to us.
Love it. Angie, I know you do things a little differently. Tell me about what your container looks like and what you encourage people to do.
I like to do similar to Sarah. I like to set the space. That's one of my favorite parts of this. And sage and everything. But I think it's just like everything else, setting clear expectations before and talking about everything beforehand. As far as, do you run anxious? Do you want me? Can I burn something that you will smell that will help you ground as you're dropping in? So I just talk about all of those things beforehand. But I also think it's important for when it's one-on-one, if they want to bring their own playlist, we can play it through my speakers. They can have headphones on if they want to. Some people like me to do that, and I'm happy to do that. I have a great playlist. We walk around my house. We set, boundaries. You don't leave the gate in the backyard if you want to be out back. So just setting clear expectations and making sure that it's their trip too. When it's one-on-one, they can kind of say how they want things to go, and I like to follow their lead.
Lovely. Leah?
I mean, mine's pretty set, you're in the clinic. You're using but yeah, it is more of but it is setting, once you come into my office, that is the container. And so we are keeping it the container. And so we are maintaining that space and that energy. And so I will have, and I do my prep whenever I am sitting with someone. So I'm making sure that I am tapped into what I need to be, and to be able to be very present and aware, and have the insight that I need to be there for them, and to let them have their experience, and to do that. But yeah, so it's not normally anything much. And then I walk them down to their ride. So that's, it's not a town that way.
Do you allow phones?
Nope. Everything's turned off.
Okay.
Yeah, all of that. Yeah. We don't want anything there. But ketamine is so short lived that, we're only looking at like an hour.
Yeah.
So, but yes, no, everything's off. Smartwatch is off, phone's off. Let's all put away.
Yeah.
We're getting them comfy, right? We're making sure that they're comfortable, that there's things that they have that they think they may need to have. So that's easy access. And it's all there. So, accessible and ready when needed.
Yeah.
Yeah, that's a big part of the container too, that I didn't mention, and Leah kind of brushed over it, but that we need to prepare ourselves, right?
Yeah.
Like, we're human. So we walk into these spaces, and I might have just had a fight with somebody that's just like, oh, but if I don't drop that, then those participants feel that from me. There's no way that you can hide that in an energy space. You just can't. And so that's a big part of the work too, is just making sure you're in alignment that day, that, when you're going into that. And because you hold that container, no matter where you are, you can be on the side of the road holding a container for somebody. And if you can be aligned and you can be confident and strong in what you're doing, they will feel that, and they will calm down, and they'll be part of it,
Yeah.
Okay.
One final question. If someone is watching this and medicine is calling to them, these sacraments, these substances are calling to them, what would you suggest? Angie, I want to start with you, and then Leah, and then Sarah, and then we'll do a wrap up.
I would suggest talking to a guide. Get going. Find a guide. If it's calling to you, start listening to the podcasts, find the shift series, listen to people's stories.
Yeah.
Talk to a guide, talk to us.
Get to a place where you feel comfortable.
Yeah.
Leah, how about you?
Yeah, I think finding as many different resources, right? Because there's a lot out there. There's a lot of information out there. There's, so really trying to find as much, have trying to have some good discernment, and really trying to figure that out. But learn as much as you can, right? Just try and learn as much as you can. Explore those things. Be curious about it, and feel about it. But if it's calling to you, don't be afraid of it. I think it's something that's calling to you for a reason. But research it, get into it, figure it out, and find out as much information as possible before. And then once you do start talking to people and getting a little bit more into it, it's okay to spend the time. Don't rush it so much that you get yourself in a situation that might be compromising. So take the time, however long that is, to get into the right space.
Thank you, Leah. Sarah.
Yeah, same thing, just kind of research, but also know that there are a lot of guides out there. So don't stop at your first one. I know that like we already mentioned that people find us when they're in a really low place. But don't take out a mortgage, don't take out a loan, don't take out there are guides that can meet you at your price point. There are guides that, some people need to pay a lot because we value money in our society, right? So sometimes it's like all you have is that $300. You will value that experience, and the right guide will give into you no matter what their price point is. They are giving into you a lot. So just make sure that you feel like you're not a burden to that person and that they're going to walk with you. No, like I say, I have one integration session, but it's always like, but I stick with you until we find the next bit of help, right? So make sure they're invested in you just as much as you are searching them out. Like make sure that they're there for you and they have your back.
Yeah, I love that. And the reality is there are all these different substances, all these different medicines. You don't have to try them all. You don't have. So really kind of sit with what is calling to you and why. Is it calling to you because you just want a trip to Peru? And that's awesome. Go to Peru. But you do not have to chase Peru to have these experiences. There's nothing that makes those better or more authentic. There's something beautiful about sitting with an indigenous tradition. So I'm not even saying it's the wrong thing. I'm saying, but it's not the only way. It's not the only thing. So just know there are options, and a good guide is going to care more about you having a good experience than working with them specifically, right? I even mentioned when people are like, I think I want a group, I'm sending them to Sarah. Because I mostly offer one-on-one, and again, there's no right or wrong. It's what does that person need? What does that person want? So, all right, I'd love to kind of do a wrap. Any final thoughts? Leah, we'll start with you. Any final thoughts? Any final things for people to know or understand?
No, I mean, I think really as much as we talk and we have the experience, I think it really does come down to, everyone just needs to know trust themselves too, right? And like what we were all saying, like as much as we need to trust ourselves, whoever is going into that space for themselves, they need to do that too. And that's an important thing. And I'm always so grateful that I could be here and talk about something that I am so passionate about and love so much. So thank you for letting me be here.
Thank you, Leah. Angie?
Same. I love this space. If it's calling you, go after it. And I can vouch for all three of you women. I've either been in medicine with you or learned from you or been guided by you. And I'm so happy to be among people who are not gatekeepers, but are open and safe and honest and loving.
Love that. Thank you, Angie. Sarah?
Yeah, just the only thing is not everybody's medicine is the same. So maybe you try psilocybin and it's not for you, but don't give up. There are so many medicines that can help us that are not pharmaceutical based, that really truly help our bodies. And some that are too, but also, like if a lot of people have that problem where they're like, I've tried it all. So that's why I said that, but just don't give up. Just know that maybe that's not your medicine. That doesn't mean you're broken. That doesn't mean that there's not something out there that can help. So, and thank you so much for this opportunity. I love these women so much.
Well, I do. I love you each too. Thank you for being here. Thank you all for always saying yes to my requests. Thank you for being so passionate in this space and wanting there to be safety and growth, both in the community and in individuals. I know your passion. I know I've seen each of you work firsthand, and I love you all. So thank you for that. Thank you for being a part of this, and we'll be in touch.
Awesome. Thank you.